Okay, you know that one of the jobs of the cardiovascular system is to distribute blood to different parts of the body. And so what we're going to look at in this video is some of the arteries, and we're going to learn and name some of the arteries. Now, the good thing here is that this is really pretty much just memorization. There aren't concepts that you actually have to try to understand as we go through this. The other good thing is that many of the arteries are actually named after body regions that they pass through or the bones that they run along. And so if you did a good job in A&P1 of learning the body regions and the bones, then that's going to help you as we study these arteries. And we're going to start by looking at what we mean by when we say the circulatory system is a closed loop. Again, just to remind you, when there are questions, I want you to pause the video and see if you can't come up with some reasonable thoughts about what this refers to. And when we say that the circulatory system is a closed loop, what we really mean is if we were to tag a red blood cell in the left ventricle as it left out through the aorta, eventually it would show up back in the left ventricle, unless, of course, it's old and it's being removed. And so that's what we mean to say that the circulatory system is a closed loop. Now, organizationally, you know that we think of the circulatory system as, again, what's the answer there? And the answer is two loops, the systemic circuit and the pulmonary circuit. And so I want you to think about the pulmonary circuit and go ahead and describe it some. So pause the video and describe the pulmonary circuit. Pulmonary circuit is actually pretty simple, and so you know blood is pumped from the right ventricle. It passes through the pulmonary semilunar valve into the pulmonary trunk. Here's the trunk, and the trunk very quickly will go ahead and divide, and that's what we mean by a trunk. A trunk is a relatively short vessel, which in fact is only a few centimeters long and which will quickly divide. And the pulmonary trunk is going to divide into the left and the right pulmonary arteries. Again, these are arteries. They're carrying deoxygenated blood, and we might say that it's venous blood, but that's not what defines a vessel as an artery or a vein. It's the direction of flow. And as you can see by the arrows, the flow is away from the heart, and so these really are the arteries. After that, the blood will pass through the pulmonary capillaries where it dumps off CO2 and picks up oxygen, and then it will return to the left atrium through the pulmonary veins. And so again, veins are carrying blood in the direction of the heart, so moving back towards the heart. And so here you can see the pulmonary veins from the right side, pulmonary veins from the left side, dumping into that left atrium. The other thing that I want you to keep in mind is that before blood can pass from a systemic vein into a systemic artery, it first has to go through the pulmonary circuit. And so you should keep that in mind. Another thing that I want you to understand when we look at differences between pulmonary and systemic circuits is 100% of the cardiac output will go through the lungs. And so here's the Q. And if the resting Q is 5 liters per minute for a person, that's how much is being pumped out through the pulmonary circuit as well. And so approximately half is going to be directed over to the left lung and approximately half over to the right lung. And you know that when we look at the systemic circuit, there is no one single organ which is going to get 100% of the cardiac output. And so you've seen this. This pie chart is showing distribution to some of the organs of the body, not all of them. You know that splanchnic refers to the liver. And so you can see that the liver is getting roughly a quarter of the cardiac output, which is more than any other organs get. And we take all the skeletal muscles and lump them together. There's way more mass for all skeletal muscles together than there is for the liver. And yet they're still only getting just a little bit better than 20% of the blood flow at rest, where the liver's getting, again, almost a quarter of it. The skin, too, has a larger mass than the liver, but at rest, less than 10% of the cardiac output is actually being directed to the skin. Okay, and so again, as you can see, only a fraction of the cardiac output from the left ventricle passes through any single organ. Another thing to keep in mind is that anytime we see the term pulmonary or lobar, then we're talking about the pulmonary circuit. Pulmonary trunk, pulmonary arteries, and then so on. All right, what is it that's shown in this picture? Well, what we're seeing is the outline of a man who is not in anatomical position. So bad, minus 2 points. Okay, well, I hope that you would have said is we're looking at the aorta. And we take the aorta and we divide it up into different segments. And so since the blood is initially moving upwards, we call this piece of it the ascending aorta. And then we have the arch, with which we're all familiar. And again, you know that there are receptors in here that are responsive to blood pressure and also to the chemistry of the blood a little bit. And then finally, the blood is headed down, at least when we're sitting upright or standing upright. And so this is called the descending aorta. We're still up here in the chest, so it's the descending thoracic aorta. What you see here is actually a skeletal muscle. It's the diaphragm. And so as we pass through the diaphragm, now we refer to it as the descending abdominal aorta. And so there you have those different pieces. Well, what is it that branches from the ascending aorta? You can see a little branch right there. And you can see another one right there. Now, we talked about these guys a little bit in the video, but these are the beginnings of the coronary arteries. And so this is the beginning of the right coronary artery. That's the beginning of the left coronary artery. Okay, what's located at the base of the ascending aorta? And the view that you see here doesn't give you a good idea. You should be able to figure it out. This view shows you better what we find there. And so name it. And I hope what you said is, oh, look, there's the aortic semilunar valve right there. And here you can see that they've got a little bit longer piece of the right coronary artery. There it is down there. And here's the left coronary artery, which very soon branches. And it branches into the anterior interventricular branch and the circumflex branch, which is slightly bigger. Here you can see the anterior interventricular goes down the front of the heart and roughly over the septum between the two ventricles. And then there is the circumflex, which is wrapping around to the back of the heart. So, and here again, you can see a part of the aorta. What is it that we see? Well, we see the descending abdominal aorta, and you know that because, oh, look, we've passed beyond. We're now below the diaphragm, and so that's how we know that this is the descending abdominal aorta. And when we look, what is it that happens at approximately L4? Well, the aorta comes to an end and it branches. And it branches into the common iliac. And so this is the left common iliac. We're looking at the front of the person, and so the left is over to this side. Okay, and this will be the right common iliac, and you can see that it branches fairly quickly as well. We'll look at that branch in just a bit. We've got some other branches coming off of the abdominal aorta that are important. This one is the superior mesenteric. This is usually referred to as the celiac trunk. And then we've traveled down a little bit further, and this is the inferior mesenteric. And these are the things that supply a lot of the visceral organs that we find in the abdominal cavity as we look at that. Here is the left renal artery, and here's the right renal artery. You can see slight differences here. The right kidney actually sits just a bit lower than the left kidney, and that's why this angles down a little bit more and is slightly longer. And the kidneys receive a tremendous amount of blood. Here you can see the extensive vascularization of these kidneys. The kidney is roughly the size of a bar of soap, perhaps just a bit bigger. So that's a lot of blood flow that goes there. That shouldn't surprise you because the job of the kidneys is to clean out the blood and send it back to the rest of the body. All right, well, what is it that arises from the aortic arch? Here's the very end of the ascending aorta. Here's the very beginning of the descending. And so here's the arch that we have here. And so you can see there are a number of things coming off of that. Here's a trunk. And so it's a few centimeters long, and then it branches. This is known as the brachiocephalic trunk. You can see it in that depiction as well. And what we have next is the left common carotid artery. And so again, this is going to travel up the neck and up to the head. And then lastly, we have the left subclavian. Okay, well, again, these terms tell you something about where these are located or what they feed. What does brachiocephalic tell you about that trunk? Well, it tells you the brachium is the arm, and so it's going to send it's going to eventually end up going to the arm. Cephalic refers to the head. It's also going to lead up to the head. Okay, what does subclavian tell you? Sub tells you that it's going under something. Well, clavian refers to the clavicle. And so the subclavian is, in fact, going to dive under the clavicle as it passes along. And so these are the arteries that are providing blood to your head, your neck, and your upper limbs. Okay, and so as we look at the brachiocephalic trunk, we see, well, here's the right subclavian. And then, not surprisingly, here's the right common carotid. And so left common carotid coming directly off the aortic arch, right common carotid coming off of the brachiocephalic trunk. Okay, what is true of most but not all arteries? Well, as you might be starting to figure out, in many cases, we have a left and a right. We have a left and a right. We have left subclavian, right subclavian, left common carotid, right common carotid. Now, as we saw in the previous slide, we don't have a right and left superior mesenteric. So it's not true of all of the arteries, but it is true for many of them. Well, which artery passes superior to the first rib and deep to the clavicle? That should be easy for you to get. And you should say, well, that's the subclavian. And we're looking specifically at the right subclavian as we look here. Okay, the armpit. What is the region of the armpit known as? Well, it's the axilla. So the right subclavian then is going to move through there and going to be renamed the right axillary. You can see it's just a continuation, though. Well, what's the anatomical term for arm? We already mentioned that on the previous slide. It's brachium. And so the axillary is going to morph into the brachial artery. Again, this is the right brachial that you see here. And you can see it is indeed running down the inside of the arm. If you palpate up close to your armpit and feel around, you should actually be able to find a pulse there. And again, you know that the brachial is the one that we put the blood pressure cuff over. We surround the arm here and we inflate it high enough so that this thing gets compressed. And that's the basis of doing blood pressures here at the arm. You can see that the brachial actually branches and send one behind the femur. See how they've made it faded out here? That's to indicate that it's actually passing behind this bone. Okay, the brachial is staying to the inside and then coming to the front of that bone. Well, which artery in the wrist did we use to palpate the heart rate? And why is it called that? And so you should have said, well, we used the radial. You can see that the radial is actually branching off of here, right about at the cubital fossa. So the cubital fossa is that depression in your elbow. Cubital is elbow. And it continues down to about the styloid process. And so here's the radial. And it runs right along the surface of the radius. Hence the name. There you go. Well, which artery is running roughly parallel to the radial artery? Look here. You can see the ulna. And so the artery that runs along it is the ulnar artery. So again, just to reiterate, some of these things aren't too hard to remember. Now, as we look at this, you can see that the radial and ulnar arteries are branching and they form these arches. And so we have one that is deep, and it's called the deep palmar arch. We have one that is closer to the surface of the skin, and it's called the superficial palmar arch. It is palmar, by the way. And here you can see a different depiction of that. And so again, thumb side, here's the radial. Ulnar, here's the ulnar coming in. And this one that is brighter red is the superficial palmar arch. The one that's a little bit darker down, you can see again, look how it passes there behind the thumb. That is the deep palmar arch. And so you have those two palmar arches there that are important. Okay, and then the other thing that I want you to notice here, at both the elbow and in the palm of the hand, we have what are called arterial anastomoses. And that means that to get blood from here to here, there's actually more than one branch we can take. This is rather like a redundant system, and it helps to ensure that blood gets there. Look here, to get to this point, blood can go down the radial artery or it can go down the ulnar artery. And to get out to here to the fingers, again, it can come down radial or ulnar. It can go through deep palmar, or it can go through superficial palmar. And so again, those are multiple ways to get blood flow to a distal area of the body. Now we move down to the lower limb. What is it that the top of the pelvis is called? I hope that you remember it's called the ilium. And so here again, we get to the end of the descending abdominal aorta, and it branches. And it branches into the common iliac. And so here we have right common iliac, and there you can see the left common iliac going over that way. Well, the common iliac divides fairly quickly. Right about the level of the SI joint, it divides into the internal common iliac. Look, it moves down in, and it actually passes through that obturator foramen. And then we have the thicker branch, which continues down towards the leg, and it's the external iliac. Internal iliac is providing blood to the viscera and the pelvic region, and so organs here in the pelvis. So, for instance, the gonads, the bladder, things like that. Well, what is the bone in the thigh? That should be easy for you. You know, it's the femur. And so we have this nice thick branch. External iliac continues down. And as we move into the leg region, it is referred to as the femoral artery. Now, we actually have a branch up here. And so we actually have two branches of the femoral artery. This one is closer to the surface, and this one is the deep femoral. But you can see that they're both medial to the femur itself until we get down here, and then the deep femoral moves behind the leg, and even further down, the femoral moves behind the femur. Now, again, you can get a pulse here, but you do have a little bit more soft tissue there, so it might not be quite as easy as getting a pulse at your carotid artery or your radial artery. If we look behind the knee, then we notice that there's a diamond-shaped region back there. It's referred to as the popliteal region. And so as the femoral artery passes through that region, well, it becomes the popliteal artery. And it's going to divide quickly into a posterior tibial branch and an anterior tibial branch. Okay, and so there again, there's the popliteal, and it is behind your knee. It's in back of it. It's running behind the femur, and now we're looking at the back of the leg. And there you can see that popliteal. And look how it's well protected. It's going down between those condyles, those big, strong condyles of the femur down there. And again, it's branched, and here is the posterior tibial. Posterior, it runs behind the tibia. Tibial, because that's the tibia. Here's the anterior tibial. It's going to move in between the tibia and the fibula. And eventually it moves more towards the front, and it feeds the front of the leg. There's another branch here that runs down along behind the fibula, and so it's the fibular artery. And now we're looking at the front of the leg. And again, you can kind of get the indication that this artery is behind the femur and the tibia. This one is behind the fibula. Okay, there's that popliteal artery. There's the posterior tibial, and here's the anterior fibula. Anterior tibial. That again is coming in between the tibia and the fibula and moving to the front of the leg. As we get down, there is that fibula, which is again in the back of the leg. Well, what is the Latin term for foot? It's ped. What is the top of the foot known as? It's the dorsum. And so not surprisingly, here's the dorsalis pedis. Again, we introduced this when we talked about taking pulse at different places. If you didn't try this before, I want you to try it now. See if you can get a pulse at your dorsalis pedis. And again, this is a good sign because it tells you that blood flow to the lower leg is good if you can get that pulse there. Just as in the hand, you can see that we have this arch. And so we have a dorsal arch. The dorsal arch, again, tells you that this is on the top side of the foot, and so it's superior to the metatarsals. But we have one that's actually on the bottom side of the foot. In the hand, they were both on the palmar side. Here, only one is down there on the plantar side, and so it is running inferior to the metatarsals. But again, you can see we have these arterial anastomoses to help to provide multiple ways to get blood flow out to the toes. All right, moving back up to the chest and looking at the aorta again. You can see that at roughly T5, that's where we find the beginning of the descending thoracic aorta, just roughly, okay? And it penetrates the diaphragm at approximately T12. So roughly T5 to T12 is the descending thoracic aorta, all right? The other thing that you can notice here is, oh, look at that. It's running just to the side of the vertebral column. It's a little bit to the left. Okay. Now, we wouldn't be able to tell that easily because the truth is what we have to do is cut away the esophagus. The esophagus is running down in front of your vertebral column, and so it would have to be cut away so that we could see that we're just a little bit to the left of that vertebral column as we go there. Well, again, we pass down through the diaphragm and we get to the descending abdominal aorta, and so it's beginning at approximately T12 and it's ending at approximately L4. Up here, again, we have the common carotids. Left common carotid is coming directly off the aortic arch. Right common carotid is coming off of the brachiocephalic trunk. Okay, there's the right subclavian. This is the celiac trunk. Celiac trunk is going to send blood supply to a number of the organs of the viscera. Here's the superior mesenteric, also going to send blood supply to organs of the viscera. Here's the inferior mesenteric. And here we can see a little bit more detail in the abdominal and the pelvic cavities. And so again, way up at the very top, we've got the descending thoracic aorta. We move down past the diaphragm, which is right here. Here's the diaphragm. It's this dome-shaped skeletal muscle, and obviously we're going to talk about its importance when we get to the pulmonary system. But we did already talk about it a little bit when we talked about respiratory pump. Okay, and so that's the descending abdominal aorta. And so way down here, again, we've branched at about L4, and here is the left common iliac. And here's the right common iliac, and then again, you can see the branch for the internal iliac, but you can't on the right side, but you can't see the one for the left side. It's under this piece of the colon that you see there. Okay, and so that's the right common iliac. Again, here's the celiac trunk. And you can see, oh, look at that. It's sending a branch to the stomach, and it's sending a branch that supplies the liver. It also supplies a little bit of the small intestine, but not much. Here's one that goes over and sends a branch over to the spleen. Again, this is the superior mesenteric. And the superior mesenteric really serves all of the small intestine. They've kind of reduced the amount of space that the small intestine takes up for clarity. But the small intestine is going to fill up this whole space in here. But you can see all the branches that are going to first the duodenum and the jejunum and the ileum. Okay. And then it also serves much of the large intestine. Here you can see a branch of the superior mesenteric that is going to large intestine. And then here is the inferior mesenteric, and it's going to serve a lot of the rest of the large intestine. And so here is the transverse colon that's been cut away, and it's going to serve transverse and descending colon. Excuse me. And now we're going to move back up to the head. And in your book, they actually talk about the head before they move on to the limbs. Again, brachiocephalic, serving the brachium and the head. There's the subclavian, and look, you can see that it moves in between, under the clavicle, but above the first rib. And here is the right common carotid artery. And the common carotid quickly branches. Here's an external carotid branch. It's going to go up and serve many of the structures of the head except the brain. External carotid stays to the outside and it doesn't serve the brain. Here you can see the internal carotid. The internal carotid, in fact, is going to move into the inside of the skull by passing through the carotid canal. And it ends up actually supplying about 80% of your cerebrum. The other thing I'll point out to you here is the carotid sinus. Again, there are baroreceptors in here that are sensitive to changes in blood pressure, and we also have chemoreceptors that are sensitive to changes in blood chemistry. Here's another depiction showing you the common carotid, right and left. And again, the right is coming off the brachiocephalic trunk, and the left is coming off the aortic arch. This is the internal. I know it's the internal because it goes up and serves the brain, serving about 80% of your cerebrum. Here's the external, which just stays to the outside and serves external structures of the head. Here's another depiction. You can see that the internal carotid here is winding around quite a bit as it moves up and gets into the inside of the brain. And so there is the internal carotid artery. This is the left branch, and there's the right branch. There is actually another artery that serves the brain, and that's the vertebral artery that you can see here. They've taken away the vertebrae, so we don't get the sense of why it gets that name. Here's kind of a three-dimensional view of the internal carotid artery, so you can see how it travels along and then moves in from the lateral aspects into the medial part of the brain, so it can get up into there to serve that. Okay, well, what is it that travels through the transverse foramina of the cervical vertebrae? And so remember, it's only the cervical vertebrae that have these transverse foramina. And so what we see there is, not surprisingly, that's the vertebral artery. And we will indeed have both a right branch and also a left branch. You can see the left branch coming up here, you just can't see the origin of it. And so this is the vertebral artery, which is arising from the subclavian artery. This is the vertebral part of the vertebral artery. Okay, and again, as I already said, they originate there at the subclavian. Well, as we get up into the brain, they're actually going to merge to form what's called the basilar artery. Now, unfortunately, this is not named after a bone or a region of the body. So you just kind of have to keep in mind that that is the basilar. Here you can see that that vertebral artery is going up the front part of the spinal cord. And here, when it gets to about the medulla, that's where it merges to form that basilar artery. And so there are the two branches of the right vertebral artery, right branch and left branch. And here is the basilar artery. And look, it moves up along medulla, pons, and midbrain before it finally branches. And we'll look more at these branches. The branch here is the posterior cerebral artery. I wonder what that might serve. And if you said, oh, it's going to serve the back of the brain, then yeah, you're absolutely right. That is indeed what it's going to go ahead and serve. Okay? And so here again, you can see right and left vertebral arteries merging to form the basilar artery. Now they are not showing you the part of the brain that the basilar artery is running in front, but again, that would be the brainstem, medulla, pons, and midbrain as we do that. Look at this. Oh, look. Arterial anastomoses forming the cerebral arterial circle. All right? Now you might remember the sella turcica. The sella turcica is that part of the sphenoid bone which actually protects this little guy right here that we talked a whole lot about in the endocrine system. And so there's your pituitary gland. And it is surrounded by that sella turcica of the sphenoid bone. All right, and so now again, just a reminder, here's the vertebral artery from this view, here's the vertebral artery from this view. And this is the left branch here, but this is the right branch there. And then here is the left branch of that vertebral artery. And then there's the basilar artery. And again, it branches into the posterior cerebral artery, which serves more the back of the brain. Here's what's referred to as the posterior communicating artery. This, in fact, is the internal jugular. And then here's the anterior cerebral artery. Here it is coming around here. And then there's the anterior communicating artery. We only have one of those. We don't have two like we do in the back. And so now this helps to ensure that blood flow to the brain doesn't get compromised, because again, as I said, we have this arterial anastomosis, and so blood can get to here by either moving up the left posterior communicating and the left internal carotid artery and around, or it can come up the right side, either way. And I just misspoke. This is the left side. This is the right side. Okay? And so again, this cerebral arterial circle is important. The other thing that it does is it actually helps to equalize blood pressure. If blood pressure here gets too high, we get a little bit of vasoconstriction to prevent too much blood from coming in this way. And we get a little bit of vasodilation over here to help a little bit more blood come in that way. And so this arterial circle plays two very important roles, equalizing blood pressure and providing redundant ways to get blood flow up to the front of the brain. Okay? Again, anterior cerebral artery, anterior communicating artery serving the front of the brain. Posterior serving the back of the brain. And then here what you can see is you can see a really, really nice corrosion cast of the cerebral arteries. Again, the brain is highly, highly, highly aerobic, similar to the way that the heart is highly, highly, highly aerobic. And so we want a nice, extensive blood supply to the brain. So in normal, healthy people, it is never compromised. And that brings us to the end of this video. And so you haven't had to learn all the little tiny arterial branches. When you go to graduate school, when you go to med school, PT school, those kind of programs, then you'll have to learn those things.